Okay, welcome everyone. Special edition of the Daily Show here. For those who don't know me, my name is Alan. I am the COO of ICE and a faculty member in our fitness athlete division. And we're super excited. We don't normally interview guests on here. It's normally just us talking to you, but we have Dr. Julie Foucher here this morning to talk to us. If you don't know Julie, she is a family medicine physician from Lexington, Kentucky. Some of you may know her as a CrossFit Games athlete. She began her CrossFit career here in Michigan at University of Michigan, went to the games 2011, 2010, 2012, and 2014, and probably most notable for tearing her Achilles at regionals, I believe, in 2015, and finishing a handstand walk event in a walking boot. And so she did her undergrad degree here in Michigan, University of Michigan in biomedical engineering, and then went on to medical school at Cleveland Clinic, where she did medical school and then residency in family medicine. And now she's a practicing family medicine physician and a functional medicine physician as well. She's also really involved in CrossFit Health, which I'll let her talk about here in a second, and then the rollout of a new collaboration with CrossFit called CrossFit Precision Care that was recently announced. So, Julie, thanks so much for being here. I know you're super busy, so thanks for taking the time. I guess did I miss anything about your introduction? And then tell me a little bit about CrossFit Health.
Oh, no, that was perfect. Thank you so much. And I'm glad you put in the Achilles tear because I'm sure that's especially interesting to your audience. But yeah, thank you for having me. I'm excited to be here and just to share some of the cool things that we're doing as part of CrossFit Health. So just a little bit about CrossFit Health, I guess, to start. It's something that started, I think, in early 2018 by the founder of CrossFit, Greg Glassman, really as I think there were a couple of different purposes. One was to really expose the truth. So there was a tagline, let's start with the truth, to get to sort of cut under some of the problems with modern medicine, with medical research, and really try to expose the truth about health. And he had a big mission also to really get special interests out of biomedical research. And so that was a big passion of his as well. And so it came in the form of a lot of education. So there was CrossFit Health conferences that were held just before the games for a few years where speakers would come in and talk on various topics. And then he started around that time an initiative where he wanted to educate physicians about CrossFit. And so he would bring them together to do the CrossFit Level 1. And I was part of that as I was on seminar staff at the time. So I was part of teaching a lot of those Level 1s to physicians for a few years. And at the same time, there was education sort of in the next room for other physicians who had already gone through the Level 1 who wanted to come back and continue learning about these topics. And so it really was a networking opportunity, I think, for a lot of doctors. I think that the downside was it was, kind of isolating for all other healthcare providers who are passionate about CrossFit and understand that it's important for creating health and optimal performance, and felt like there wasn't really a role for them. And so as we move into this new chapter of CrossFit Health, that's something that's very important to all of us, is that we're including all healthcare professionals and all working together because we have such an incredible community of CrossFitters, people who love CrossFit all around the world who are also involved in healthcare. And if we really want to change the healthcare system, if we want to change the standard of care, we need everybody to work together and do that in different ways in their communities and for the populations that they serve. So that's a little bit of background about CrossFit Health. And then really there was sort of a big shift as the shift happened with ownership of CrossFit a little over a year ago. And Eric Rosa came in as the new CEO. I met him last July of 2020, and we just talked a lot about what CrossFit Health could be and what role CrossFit could play in healthcare. And we aligned on a lot of things, and it just started a series of brainstorming sessions for what the future of CrossFit Health might look like. And so there really hasn't been much coming from CrossFit Health over the last year up until recently, because we spent a lot of time thinking about it, a lot of time doing focus groups and really trying to figure out what is the best path forward for CrossFit Health in order to truly change healthcare. And so that's where we're at now is The first offering from CrossFit Health we just announced a couple of weeks ago is CrossFit Precision Care, and that's a primary care health offering, and I can talk more about that. But there's also a lot more in the works that we're looking towards the future in terms of how can we create something that serves all healthcare professionals who are involved in CrossFit and who want to take this to their communities and build these bridges between the healthcare system and what's happening in their affiliates.
So before we get into precision care, we kind of on our end, traveling and teaching rehab providers how to work with the fitness athlete, the CrossFitter, the Olympic weightlifter, the power lifter. We got a lot of questions when the CrossFit MD level 1 rolled out about where is our CrossFit insert X level 1? Where's the CrossFit PT, the CrossFit OT, the CrossFit nurse practitioner level 1? So is there a plan to continue the MD level 1s? And then is there a plan to expand that program at all?
So from my understanding, and there's plenty more going on at CrossFit that I don't know about, but from my understanding, no, there's not a plan to continue the MDL level 1s. I think that the other thing to note is that level 1 was the exact same level 1 that everybody can get every weekend all around the world. And so I think we obviously want to continue encouraging everybody to go through that. I think it's great foundational education for anyone, whether you're a healthcare provider or not. Anyone who does CrossFit, just to learn the methodology and the basics behind it. But I don't think there's any specific plan to do, a level 1s for particular groups at this time. I don't think that it's out of the question if that's something that we want to do in the future. But I do think we want to create other resources, tools, education, networking opportunities for everybody.
Okay, cool. Right on. Would you speak a little bit now about the CrossFit Precision Care program that was recently announced and kind of how that rollout is going to be planned?
Sure. So CrossFit Precision Care is a primary care telemedicine service for, with CrossFit physicians and health coaches and care coordinators who all do CrossFit. Our approach is a little bit different from what you'll get in traditional primary care, where we're really taking this precision medicine approach, which means we're not giving standard recommendations for every single person who has the same symptoms or the same disease state. We are looking at each person as an individual, and we're taking all of those factors into account, whether it's their genetics, their lifestyle, their environmental exposures, what their specific goals and needs are. And we're creating a plan that's really personalized to them. And this came about through a partnership between CrossFit and a company called Wild Health, who's been doing precision medicine and delivering this approach now for several years and has had great success with their patients. And basically, when I met Eric and introduced him to Wild Health, he really liked the approach. We both saw that there was a lot of alignment there between their approach and how we think about health in CrossFit. It's very data driven. It's obviously lifestyle first. We're obviously looking for root causes rather than going to medications or procedures first in most situations. And so it just seemed to fit. And so what we've done is taken Wild Health's approach, modified it to more authentically fit the CrossFit community. And that's a continued work in progress. And we'll be collecting a lot of feedback, especially in this beta rollout. And delivering it with, professionals who are CrossFitters themselves. So how it works is each patient, once you sign up right now, you can basically go to the website and sign up for the wait list. And in a couple of weeks, we'll be starting to accept patients off of that wait list in 8 launch states. So we're only starting with 8 states to start because of physician licensing. So it's just very limiting. And right now we're starting with a small beta version. But I believe that very quickly in 2022, we'll be rolling out to most of the US, if not all of the US. So from those 8 launch states, we'll accept patients off the wait list. You'll be able to then sign up for a plan. There are 3 different plans. This is all outside of insurance. It's a direct primary care type of membership. So you pay a monthly fee for your primary care. And then you'll choose a plan depending on how often you want to see your doctor and your health coach. You'll then get pretty extensive lab testing, DNA testing. The lab testing, you can go to a local LabCorp or Quest lab to get your labs drawn. The DNA kit will be sent to your house. You'll submit a saliva sample and mail it back. You'll fill out a lot of questionnaires. So we can, like I said, we want to learn everything about you so we can make a really personalized plan. So we'll want to know everything about your medical history, your family history, your current lifestyle, any metrics that you're tracking, your performance metrics, your sleep, so on and so forth, what your goals are. You'll have a quick call with your health coach just to sort of get to know them and for them to better understand what your goals are. And then once all this data is back, you'll sit down with your doctor and your health coach for an initial appointment. And this is really where we start to put all the pieces together and where the algorithm that Wild Health has built comes into play and is extremely powerful. So it takes all this information into account and then gives really personalized recommendations in a variety of domains, from nutrition, sleep, exercise, mindfulness, or neurobehavioral, which includes mood and things like mindfulness, chronic disease, things like heart disease risk, Alzheimer's risk, inflammation, insulin resistance, longevity, gut health. And so then we start to go through what those recommendations are from the algorithm and really personalize them based on the person sitting in front of us, and what your goals are and what's actually going to fit into your life and what is going to have the biggest impact in terms of getting you towards your goals. And so by the end of that appointment, our goal is to come away with maybe 2 or 3 things that we're going to do to move forward to get you closer to your overall health goals. And then you'll just iterate on that plan. Over time, you'll see your doctor or your doctor and your health coach. You'll track your progress towards those goals. For each goal, we want to have an objective measure that we're tracking to know if we're moving in the right direction, whether it's, looking at our insulin resistance and tracking our A1C, or our inflammation and tracking our CRP, or maybe we really want to work on, the stress response. And so we're tracking heart rate variability. There are so many things that we can look at, or maybe we're really performance focused and we're going to track a couple of your performance measures over time. And so we track those over time. And then we also we have an objective health score that each patient gets. That's sort of a composite of a variety of lab markers and biomarkers and risk scores. That's something also that patients can track over time just to see if they're moving in the right direction in an objective way. And that's really how it works. We're just kind of iterating, setting new goals, looking at new measures, and kind of moving on this path towards optimal health or whatever your goals may be.
That's awesome. And I have to declare my bias here in that I've been a Wild Health patient now for a while, and that I absolutely love it. I've already incorporated, started over the summer, incorporate a lot of good changes with my physician and my health coach. Couple things that had never, ever been discussed with me, mainly because I'd never had a genomic screening before, but missing some of the enzymes that process caffeine. And so that my caffeine half-life is probably closer to about 16 hours, which is, about 2.5 times normal, which was eye-opening to me as I was sitting on that call and being asked how much caffeine do I drink. And I was actively drinking an energy drink and saying, I don't know, I guess a decent amount. And then, being told, you should probably stop right away because it's probably really messing with your sleep, even if you don't think it is. And it's probably not giving you anything performance related. And so among other changes, that's a major change I've made over the past couple of months that's really helped me feel better subjectively, but also objectively perform better in the gym. And then getting a couple of recommendations for just a few supplements, not too many. I think I take 4 different things now that have really kind of helped me go to the next level with physical performance and kind of feeling better from a well-being perspective. So I'm a giant fan, but obviously I'm biased, but I love it. I have my next follow-up actually next Friday. I just scheduled it this morning.
Oh, that's awesome, Alan. And I would say too, just to emphasize from your point, it's that there's so many things that can be really eye-opening when you start looking at genomics, but I love what you said, that it's something you tested and then you noticed an improvement. And so let's say that you had that SNP for caffeine and you took it out, but you actually felt terrible and your performance got worse, then we'd probably say, hey, maybe you should add the caffeine back in. So it's something that gives us a starting place to do these tests, but it's not the end all be all. It's not sort of like the hard and fast rule. It just gives us a place to set hypotheses that we can test and try to get us closer to what our goals are.
Yeah, and I love the intervention too, that just it went beyond supplementation into just making easy changes with nutrition to get kind of the results wanted. Just being told, I've always had an issue with kind of cholesterol my entire life. And I've always been told to eat better, which I haven't always been the healthiest person, but the past couple of years, it was hard, to go to my previous primary care doctor and be told, well, try eating better. And I'm thinking, I literally eat nothing bad now. I exercise all the time. I don't know what else I can do. And then being told, some of these SNPs for your fat metabolism aren't the best, and supplementing with some fish oil, and then switching out some of my meals to be fish-based has helped me turn the corner there, which is something nobody had ever addressed before as far as my healthcare had gone, which is awesome to see.
That's really cool. That's really cool.
So with that program, I have a couple questions for you. Is the goal there that every CrossFitter be linked up with CrossFit Precision Care? Is that kind of the end goal of the program?
I mean, of course that would be great. We're not, I don't think that we want to say it's, everyone has to, like, we just want everybody to get medical care that's consistent with their goals and helps them, is something that they're comfortable with. And I think that this is a great option for people who maybe are frustrated by the current system, not aligning with what they're learning in their CrossFit affiliate, or, their doctor not understanding CrossFit or telling them to stop doing it. And so this definitely gives them another option, and something that, like you've mentioned a few times, is very cutting edge. And oftentimes, there's a lot of research out there. There's a lot of data about genomics. And like I said, it's not prescriptive, but there's a lot of information there that we can use to guide what we're doing towards better health. And that is not yet being incorporated into conventional care. It takes decades for things, as you know, to be incorporated from the research studies into conventional care. And so we're a little bit ahead of the curve there. And we're cautious about it. We're not doing anything that's crazy, but we're using the best information we have to inform recommendations that we make. And so I think, it would be great. We would love for everybody to do it, but I don't think that's necessarily realistic. We'd also love for people who don't do CrossFit to use this type of care. I think it's great for people who do CrossFit. Maybe they have a sibling or a parent or a friend who's too intimidated to walk in the CrossFit affiliate, but maybe this is a way for them to start making some positive changes in their health. And then over time gives them the courage and the confidence to actually walk into an affiliate and start working more seriously on their training. So that's another kind of long-term goal that I have.
I love that. Imagine if you went to see your primary care doctor or met with them virtually through Precision Care, and their recommendation was to start CrossFit as their prescription. How cool would that be?
So cool. And I think that, I'm curious to see how the CrossFit on-ramp rolls out too, this sort of virtual version of an on-ramp that then introduces someone to a local affiliate. I think that that's a great way. It's something that I hope we'll be able to use with Precision Care with our patients who are not already members of an affiliate, as a way to introduce them. And I think, like you said, this may often happen for you, where you have a patient who you're seeing for an injury or for rehab. And then now that they're in the gym, they have some curiosity and they want to start doing CrossFit. And that's kind of the same thing we're doing. I think for all of us as healthcare providers is, how can we start to build those bridges to get people who really need it into the CrossFit affiliates?
I love that. Right on. With that rollout, for those who don't know, from what I understand, to get involved on the physician side of things with Precision Care, you have to go through a 12-month fellowship program. Is that right?
That's the best way. Yes. I think, right now we're planning to hire more doctors next year. So we may expedite some people through that fellowship, but that's probably the best way to get started. We also have for someone who doesn't want to commit to the 12-month fellowship and kind of the clinical training that goes along with that, there's also a Precision Care 101 course, which is basically a video-based asynchronous course that anyone can do. It's scheduled to take about 2 months, in a few hours a week. So those are both options to kind of start learning about precision medicine and get started.
So the baseline requirement to be a health coach through Precision Care is a background in coaching, and that you are a CrossFitter. Beyond that, what are you looking for in those non-physicians who you like to come on board as health coaches?
Well, healthcare experience is certainly helpful. We have several health coaches now with various healthcare experience, whether it's nursing or dietitian. We have a pharmacist. Um, so anyone who's really has experience one-on-one coaching someone in a health related field is great. The healthcare experience just helps to give more context, to the medical side of things, but it's not necessary. CrossFit trainers are great candidates for health coaches. Obviously it's a full-time position, but for someone who is a part-time CrossFit trainer and maybe coaches sometimes in the morning or nights or weekends and has another full-time job that they don't really love, but they're doing it to make ends meet, this could be an option for them to be able to sort of coach full-time. So I'm excited about that opportunity to give people.
So right now, are you only looking for folks who have availability for full time?
Right now we are, yeah.
Okay.
Just because we're sort of rolling this out in a limited model. I think the more we're learning, and I think we're going to learn a ton, especially in these first few months of what the community wants and needs. I do think that we'll probably come up with other options or other models to meet the needs of affiliates. So yeah, I don't think it's out of the question in the future, but right now we're just looking for full time.
Okay. With this rollout, how are you all viewing it? And this is something I'm always chasing, especially my own practice of making healthcare more accessible and affordable. So
Mm-hmm.
just thinking big picture, CrossFit membership is maybe about $150 a month. And
Mm-hmm.
now precision care too. How are you, if the goal is to get as many people as possible in this program, how are you all chasing making that as accessible and affordable as possible?
Yeah, it's a great question. And I think it's one of the biggest things that I struggle with about this model. Um, so I think to start, for me, direct primary care, which is what this model is, it's paying out of pocket a membership fee for your primary care. It is a model that can actually save people money on healthcare. I'm not everybody, not somebody who maybe has a medical condition or a medication that's really expensive and needs more insurance. But for someone who's generally healthy, if you use a direct primary care model like this for your primary care, and then you go to a higher deductible insurance plan with a much lower premium, you can often save overall on the amount you're paying on healthcare. I think one of the most challenging things for people to see is how much we all are paying for healthcare and where that money's going. And so often if we're using it for a primary care, we're paying down a huge deductible, even when we pay for things like labs or imaging, but we haven't met our deductible yet. Oftentimes we're paying like 3 or 4 times as much as these things would cost if we pay cash. So I have seen that overall in the direct primary care world. So it is possible to actually for a win-win for the patient to save money and to get more time with their doctor and for the doctor to be able to practice in this way. The other thing I would say is, so Wild Health is exploring looking at using a split model where they bill insurance. It's not something we're testing in precision care, but separately they're looking at testing that. And so that's something that, if it works, it may be something that we look at in the future for precision care to make that membership fee less expensive and to bill insurance as well. And then I also think there's something about this that I think we just have to have patients and a long-term goal where, the current healthcare system isn't working, and trying to fit this into the current healthcare system, I've just seen it happen over and over again. It just doesn't work. And so going outside the system to do something different and then proving that thing works, and then going back to try to get insurance reimbursement or look at payment models that are more affordable and more accessible, I think also gives me a lot of hope. But it's something that is more of a long-term goal rather than making it super accessible right up front now, which is hard. Um, and then I think there's also opportunities for us to think about how we can have, scholarships, how we can have memberships, have an affiliate support, member, just the same way that you may look at affiliate membership fees. How can we make that more accessible to everybody? Can we have scholarships? Can we have, members of the affiliate offer to pitch in to cover memberships for other people who maybe can't afford it as much? I think there's a lot of creative ways that we can look at that as well.
I love that. I think here in my practice, we are one-on-one for an hour. We don't have any ancillary staff or anything like that. And I guess we take for granted that we have an hour with each patient. But probably what I enjoyed most about my visits through Wild Health is like I literally have the whole hour. The whole hour is for me. And it's amazing how much you can get done in an hour versus kind of the traditional model where it it seems cheap because you
Mm-hmm.
get to use your insurance, but you may only get 15 minutes and then it takes you months or years or maybe never to get the result that you come into the office for versus maybe paying a little bit more upfront and
Mm-hmm.
getting to the root of the cause a lot quicker and getting the result a lot quicker.
Mm-hmm. Yeah, there's so many factors and just looking at that big picture instead of just like how much am I paying for this, and also looking at the value of like you said, what are you getting for the approach?
You said something a while ago that really hit home about sometimes CrossFitters go to their doctor who tells them to stop doing CrossFit. And so I want to switch gears a little bit and talk about the role of the rehab provider in this. Aside from getting involved as maybe a health coach potentially, what are there any plans to develop some sort of network? Because we hear this a lot, and it's the reason we developed our courses is like our goal is to keep people in the gym, to keep them CrossFitting, help them modify around their injury while we help them get through it. But the ultimate goal is always to keep that person in the gym. And it's unfortunate how many people end up on our doorstep who have gone to other providers, both physicians and rehab providers who have told them to stop doing CrossFit. And so they maybe haven't done CrossFit in months or years. And oh, by the way, they're still dealing with their shoulder pain or their back pain. So,
Mm-hmm.
so where do you see that happening with all of this?
So a couple ways. I think for one, just within CrossFit Precision Care, we are taking very seriously making sure that our patients are being connected and referred to the local experts that they have. So we're sort of a big picture primary care home for your health, but if you need extra nutrition support, if you have, something that you want to work on with a rehab professional, we want to know who's in your affiliate, who's in your local area that is going to be able to help you with that and make sure that we're referring and that we're also communicating back and forth in the best way we can so that we're all on the same page and we're working together. So I can say like as a new patient comes in, that's a question we're going to be asking them is who's in your affiliate, who's in your area, if we need this kind of help. Um, and so that's something, I think your network of PTs, we want to have on our local network, on our local list so that we know who's where and we make sure that we're referring our patients to you. And then I think on a bigger scale, that's definitely, like I mentioned, a mission of CrossFit Health is creating this larger network, this larger network of referrals, not just from us at Precision Care, but from all of the physicians who do CrossFit to be referring, or other healthcare providers to be referring back and forth to each other so that we're sort of taking care of our people, our CrossFit community.
I love to hear that. I had a question I'm forgetting. Is the eventual goal here as this network grows of both precision care providers and affiliates and athletes that are in the program, is the goal eventually to have maybe a health coach inside a box of having enough clients in the area that is a service that the affiliate can say that they offer, that they have a precision care trained health coach on staff at the affiliate, or maybe there's a coach in the city or region that travels between a bunch of different boxes or something like that?
Absolutely. That's definitely a long-term goal. And I think it's something we're testing now in a small way. I mean, the health coaches that we're starting with, all of them have sort of a home affiliate. So seeing how that goes and what's the difference between when they're taking care of a patient who's a member of their same affiliate that they see in person, that they run into throughout the week versus through telemedicine. I think it's going to be a lot better when it's someone that you are seeing in person and you have those unplanned interactions as well. Right now, like I said, we're limited. We're starting with a beta. We're basically taking 160 patients a month for the next couple of months to test this out. But as we grow, that is definitely a goal to have a health coach in each affiliate or in each region so that you can be working with them in person, and hopefully also a physician in each big city, in each region, so that they can have in-person interactions as well if they want.
Wonderful. Um, I don't have anything else for you. I would just ask before we wrap up, is there anything you'd like to say to all the rehab providers who are going to listen to this? We're going to blast this as far and wide as we can.
That's awesome. No, I would just say thank you. You guys are such pioneers and leaders for our community and how to do this well, how to actually serve your affiliate and build this bridge between the healthcare system and what CrossFit is doing every single day. And so, we're also trying that from a primary care standpoint, and it's new and we're learning. And so we appreciate your feedback and your thoughts. And any of you who have practices that are really closely paired with CrossFit affiliates, we want to hear from you so that we can build out, like I said, our referral list. So if you can help with that, Alan, like rounding those up, we'd love to just have that internally with our team so we make sure we're referring our patients to the right place.
And if people wanted to sign up to be a patient with Precision Care and or look at becoming a provider in the provider side of things, that website is care.crossfit.com, right?
Correct. Care.crossfit.com. Yep. You can sign up for the wait list. You can learn about any of the positions we're hiring for. We're even hiring for all kinds of like engineering, all kinds of stuff. So if you have friends who may want to help, and then those education courses are on there as well. And I can follow up with you, Alan, with a discount code for that Precision Care 101 course also, if anyone's interested in doing it.
That would be awesome. Okay. You can find Julie on Instagram. She has her own podcast, Pursuing Health, where she interviews CrossFit athletes, other healthcare providers, researchers on a variety of different topics with performance and nutrition. So if you're not subscribed to Pursuing Health, I definitely recommend that you sign up for that. Other than that, if you're interested in getting involved with this, feel free to reach out to me. Feel free to reach out to Julie or find more at care.crossfit.com.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.